It's nice in theory to think that you could stop paying for traditional health insurance and have an alternative that you feel better about and that actually covers you when you need it. But how does CrowdHealth membership actually work in application when something really big happens that you need coverage for? Today, I'm giving a specific example of how big bills get paid when you are a member of CrowdHealth. This is a case study of a member from Dallas, Texas. If you've been curious about CrowdHealth as an alternative to traditional health insurance, but not quite sure how it would work, this is going to be so helpful for you. And if you are going through the process of applying for membership, make sure to use my code. It's Chelsea, CHELSEA. It gets you a great discount so that you get your membership for only $99 a month for your first 3 months. So you can really try on how it feels and works for you. I recently did a video about the 4 steps of becoming a member of CrowdHealth, but today we're going to talk about the 4 steps of actually using it. For better or worse, step one is having medical expenses, a medical event that happens that's going to incur bills. In this particular case study, a CrowdHealth member from Dallas, Texas was diagnosed with cervical cancer and needed a hysterectomy. Step two is negotiating the costs. You are a cash pay patient showing up for services, but this time you have a dedicated care advocate who's going to help you navigate the process, negotiate costs, review line item by line item of what's being received, and help make sure you're getting a good faith estimate and cost for what you're being provided. In this case study, the local hospital quoted $48,000 for what would be included for medical care, and CrowdHealth helped to negotiate that down to $9,190. Step three is crowdfunding the expense. As long as you're on the original plan, your member commitment for that medical event is going to be $500, and the rest goes out as peer to peer funding requests to other members in that month. In this case, 142 members received an email that month saying that here's a request for a specific amount to contribute towards this bill. An average crowdfunding request amount of about $64 per member. And then the contributions were collected, deposited into the crowdfunding account for that member so that they could directly pay their bills and not go into collection. One thing that really impresses me is that month after month in the transparency files, the approval ratings for share requests is between 99 point something and 100%. And the turnaround of how quickly it goes from a share request to funding into an account is usually about a week. And so, step four is to be able to engage in better healthcare without insurance. The member from Dallas, Texas was able to receive the medical treatment that she needed without the burden of a large bill or the headache and hassle of trying to navigate negotiating on your behalf. The CrowdHealth resources and peer to peer funding community came together to make sure that this would go as smoothly and efficiently as possible. And if you've been considering it, take this as your sign to take the step and start the application.